Whenever you're ready.
Okay. Take a motion to accept the minutes as presented. Someone, please.
Whenever you're ready, so move for acceptance.
Okay, so moved. Can I get a second?
Second.
I'll second. All those in favor indicate by saying aye.
Aye.
All right, minutes accepted. Okay, let's get on to the agenda, and I'll turn it over to Christine at this point. And first item on the agenda is board vacancies.
Yes, so this has been one that we've had on multiple agendas now. We are still trying to find someone to fill the mental health slot. I've asked our licensed clinical social workers that when they're out and about doing their business to go ahead and invite anyone, any mental health practitioners that they meet. They have that, so they're working that, but we have not had anyone apply yet. So that is just something to keep in mind there.
Okay. Second item on the agenda is staffing and limitations. Harry, you're on twice. I think you're giving us the echo.
Well, let's see if I can get off.
I've muted your other person, so you might be fixed.
Okay.
Or you may throw the other person off who's having hardware issues.
Christina?
Yes, sorry.
Staffing and limitations?
Staffing, yes, current activities and limitations. So on the health side, we are actually doing okay. Lauren, you can correct me if I'm wrong on staffing. We have our 2 licensed clinical social workers. They're paired up working on the ARCH program right now. It's going well. We have 2 public health nurses that overlap some on their days and hours. So that's helped a lot on being able to carry out different vaccine clinics that we've been holding. We have, multiple public health specialists, and we're actually looking to add another public health specialist to work with emergency preparedness soon. So we are doing well. We've gotten a full-time admin hired back. For a while there, we were without a full-time admin, and it was rough going there for a while. But so we are doing pretty well on that side. Limitations, we are working with the state right now. As many of you know, Jackson County finished their relocation and have moved to Lee Summit. And so we had been working with the state to arrange for independents to be able to do birth certificates, death certificates, vital records again. We are still working with the state on that. It's been going on for a couple of months now, trying to get that done. Hopefully we will be able to do that very, very, very soon. We have the printer, we have everything there, we're ready to go. We just, the actual technology services part is hanging us up. So, I mean, we have a lot of mental health going on. We're working on a lot of events right now. They're getting out into the community, so I'm very happy about that. I know that CSL Hawthorne has events coming up. We have at the end of August an opioid overdose awareness day that they're going to be out working with and passing out Narcan, and ARCH. The ARCH program is going to be out introducing themselves to the public. They did National Night Out this last week. So, I mean, the staff are out there and they are staying busy and doing their best to be known in the community. I don't know what more you guys would like to know, but I'm very happy with how things are going, and we're applying for lots of grants and doing our best to be out there.
Can I ask you on the Narcan? I thought I saw something in the paper like a week or 2 ago. Is there a generic that was just approved? for Narcan that might be, you know, I don't know if you're paying for it, but it'd be cheaper or anything like that?
So my understanding is they were approving an over-the-counter version, a non-prescription version that you could get. We are actually partnered with MIMH out of St. Louis. St. Louis, they are providing us free Narcan. So we can't do much better than that. So we are happy that they're sending us the Narcan, and the only requirement that they have is that we have to distribute directly to the people. We can't, you know, give it to a first responder to use in their job. It has to be for a normal citizen to have and to use. Otherwise, you know, we don't charge for it. We only collect their zip code and how many boxes they're getting. And as long as we track that and turn it in, our partners are happy to keep sending us free Narcan. So we're happy to distribute it. Now, in fairness, they're getting it through a grant, so they're not out a ton of money either. So
How does that work? Giving it to citizens? I guess I don't understand that, how that works.
I mean, it's as easy as they walk up and they say they saw we have free Narcan to give away. We give them a training. We have handouts to give them as kind of reminders about what to do. But we've gone through a train the trainer version. So we talk to them about how to use it, when to use it, what to look for. And then we hand them a box and they go on their way. And we don't collect any of their personal data outside of that zip code because we know there's a stigma and we just want to make sure that they have it.
Is this
And- Or, excuse me, but what you provide is only for Independence residents?
Yeah, we advertise that it's for Independence residents only. I've instructed staff to be extremely forgiving with that. There's somebody who comes and, I mean, they're from unincorporated Jackson County or from Blue Springs or Buckner, we're going to distribute it. It's far better for them to have it. If they're there, we want them to have it.
Am I on? I'm still having technical issues. Okay. This is nasal spray Narcan, not the injectable Narcan?
Correct.
Okay, because we're with the fentanyl, some of the doses are so high that you can't get them back with nasal spray Narcan. So I was wondering if there was an avenue for us to get. It's like I carry tourniquets in my car. I've got a bag with about 8 tourniquets. Luckily, I haven't had to use them yet. I'd love to have my go bag have Narcan in it. But I'd like to have injectable Narcan. And so,
Well, I can't get you free injectable Narcan. I can get you
I
a
didn't
box
I didn't
of the
necessarily
Narcan.
think it would be.
Yeah.
I'm happy to go out and buy Narcan.
Yeah.
And
Well,
I still have a license, so I can go do that. But mom and dad, it wouldn't be a bad idea to have Narcan in the kitchen cabinet. So,
well, and the good news is the boxes we give out have 2 injectables in them with the idea that, yes, one might not immediately work. And you
The
have a
nasal-
second
the nasal spray.
of the nasal spray.
Yeah. And at least hopefully by that time they've called 911. And
So what's the shelf life of Narcan like that? Is there? I don't know.
I don't know. I would have to check. Lauren, do you know what the shelf life of the Narcan is?
I believe the ones we have go until at least 2024, from what I remember.
Okay. So are you doing any school-based immunizations right now?
No, we are not. That is one of the big things that we're trying to work on. Traditionally, the city a long time ago didn't do a whole lot of immunizations, and it took a long time for them to do medical billing to insurance. The company that we wanted to go through for medical billing for insurance didn't want to work with us because we were too small. So we had to put it out to bid to try to find someone to help us do that. And so we are going through that process again to be able to do, well, to do all the credentialing for Medicaid, Medicare, and all of the insurances. So we're going through that process. And then our hope is once we get through that, we'll be able to start back up our mass vaccine clinics.
So are you seeing hesitations as are still from families with regard to immunization, kind of a fallout still from COVID?
Anecdotally, yes, absolutely. It's been years since we've been able to do full immunization audits. Our hope is that we'll be able to start those back up also. So I can't give you those numbers, but I can tell you across the board and across the country, those immunization numbers are down. So, and what we hear anecdotally around is that absolutely immunizations are down.
Okay. Anything else on staffing and the limitations therein, Christina?
I don't have anything else, no.
Okay, if that's the case, then communicable diseases.
I have Lauren on here. I know Lauren was going to share a little bit of what we're seeing, though I know she, some of the numbers are low enough they have to be suppressed, but she was going to share just broadly what was going on.
Okay, so I'll start with COVID. That's been going down since February and kind of stabilized out around June. We're seeing an average of 2 cases per day. Last week, there was 11 cases per 100,000 residents over the 7 days. It's up a tiny bit from the beginning of July, but the numbers have stayed relatively stable on those ones. We've had a couple of scattered flu cases in June and July, but not a lot. In terms of reportable diseases for July, we're still finalizing those because as the tests finish up, we add more cases. But preliminarily, we have mainly animal bites and STIs. We had 16 animal bites that were reported and 22 STIs. We had 16 cases that required a full investigation. Those included enteric diseases, ehrlichiosis, a couple of tuberculosis. And we did see earlier this year a pretty decent amount of strep A that peaked in February and March, and we're still seeing a couple of cases, but not as many invasive strep A's as we saw earlier. And we have seen a couple Legionella this year, but not in the last month. I think that covers most of what we're seeing.
Have you, in the past few months or during this year, have you seen any tuberculosis or syphilis?
We have seen latent tuberculosis. We did have a suspect case that ended up being something else earlier in the year. We're treating a couple of those latent TB cases right now, but we haven't seen any active this year, at least. We did have some last year. And we are seeing syphilis. That's not the majority of our STI cases. They're lower than they were. Our syphilis cases are lower than they were last year, but I still see a decent amount of those.
Help me here. Syphilis is an indicator of what? Or is that a leading indicator of just drug use or what?
There's been a pretty significant syphilis outbreak going on in Kansas City and the surrounding areas for the past few years. I know in Kansas City, it's been a big concern with the increase, especially because we've been seeing a lot of, well, not a lot, just some of the cases are in the more later stages of syphilis, and we have seen some mothers pass it on to babies. So I know there's been a concern for getting syphilis cases treated, especially in the past year.
Anything else, Lauren?
no, I think that's about all we're seeing right now.
Okay. That would conclude our agenda for this evening. Is there anything, Christina, that we need to prep people for next meeting date? If there's anything that folks want us to cover in the upcoming meeting, we'd entertain thoughts on that as well.
Yeah, our next meeting would be scheduled for October 5th. It's a Thursday. We are happy to discuss anything you guys want, and if you can't think of it now, you should feel free to email us and we will make sure it gets added to that agenda so it's ready to be sent out.
Okay. With that being said, I entertain a motion to adjourn.
So moved.
It's been moved. All second. All those in favor say aye. Oh, go ahead. All right.
Aye.
Hey, thanks folks for your attention tonight, and we'll see you in October. Thanks, Christina, Lauren, thank you.
Thank you.